Hello, Doctor. I'm Bree Plotzker from Empire Surgical. I see that your office is busy today, so thank you for taking your time to meet with me. I understand that you currently see a handful of osteoarthritis patients here within your practice, and I'm not sure what product line you're using in terms of hyaluronic acid injections to treat them, but I have some information here on Orthovisc, and I'd be willing to share with you the benefits and features of our product and see if it's something that can go ahead and further your practice and something that you'd look to obtain within your practice in terms of treating these patients. Our product, Orthovisc, is a Johnson & Johnson product. It is FDA approved since 2004, and it runs a treatment of 3 to 4 injections along the course of treatment from start to finish. Most of the other hyaluronic acid injections account for anywhere from 1 to 3 injections and don't quite have the same efficacy as ours. The efficacy seen with our product is greater than others, more so for the reasoning that our injections contain the most amount of hyaluronic acid within them, and they lack the preservatives that some of the other product lines have within the syringe to really minimize the active ingredients and preserve what they have. There's no beneficial factor to any of those preservatives. If anything, containing formaldehyde within a syringe cannot be safe for an injection within a joint cavity and internally within the body. So our product line, like I said, has the highest amount of hyaluronic acid. Now, thinking about what hyaluronic acid does and how it activates the synovial fluid within the joint, that's pretty impressive and pretty important in the sense of obtaining the most efficient and effective injection and course of treatment. So hyaluronic acid, what exactly is it going to do? It's going to lubricate the joints and act as a synovial fluid, as well as act as a shock absorbing factor within that cavity. It's going to prevent that bone on bone rubbing. It's going to prolong your patient from maybe a extensive operative situation, extensive operative surgery, with a total knee replacement. So, wouldn't you want your patient to be in comfort and prolong their injury or disease so that they're not going to go under the knife and be in this drastic pain? What our product does is it allows for up to 6 months of pain relief, and truly it acts as that lubricating joint space, to lubricate that joint space. It has a high molecular weight. It is important in the sense that the viscosity of it is increased by that binding affinity of the high molecular weight. Some of the other active ingredients within the other product lines are avian based. Ours is all biological components. So why would you want to put any bird substance into a joint when you could take all the biological components within our injection and go from there and have a greater efficacy of treatment? So all seems well, and you might seem to be in which product line to use. I've brought to you an illustration here that really demonstrates our product in response to how it matches up to the other products out there. Like I said, the highest concentration of HA is seen within our product. The high molecular weight is seen within our product. The viscosity is extraordinarily greater than most of the products out there. I believe that Halogen is a 295 viscosity, where ours is 55,000. That's huge. That's the shock absorbing factor that's going to be within this joint. The adverse effects with our products is also drastically lower than most. The adverse effects are extremely minimal. It's truly just the adverse effects of any injection within a patient. You're going to inject your patient, there's going to be somewhat of a little bit of inflammation or discomfort for the time being, but the adverse effects seen time after time of the injections is the same. Whereas one of the other products out there, it goes Synvisc goes from 7% seen of adverse effects in the first injection to 22 in the second injection. So now that drastic increase in adverse effects is not seen in our product. Time after time, it has the same efficacy and same end all result of the beneficial factors in which it has to offer. I will leave this here with you. I also provided you with a folder of just other information on Orthovisc. Really just, here's a DVD of how it works, a little bit of tips on it, as well as some brochures that I can leave within your office. Pretty neat how Orthovisc is sponsoring the PGA Tour. It's huge. I mean, if the professional athletes are willing to use it, I don't see why anybody else wouldn't want to use it as well. It's a product that I would look to inject into my own knee if I needed it, and I truly do. I hope that this is something that your practice would benefit from using, and if you don't feel quite comfortable yet with it, I know that I can provide you with a free trial kit on it where you can go through the whole course of treatment with a patient and really see for yourself the benefits, the ease of use, and see the patient's results and the patient's response of the treatment. That's definitely something I can provide for you, as well as the brochures, information on reimbursement, educational information, Orthovisc, and just go from there. I'm not sure if you're the one doing the ordering or if you go through an inventory manager, but if you can put me in contact with that person, that would be great moving forward from here. And like I said, I'll offer you those free trials. You can see for yourself if this is a product line that you're willing to use and have within your practice, and I'll look to keep in touch with you. Okay, so this is something that you're familiar with. It's not something that you're using yet in your practice though. And I mean, I want you to be comfortable with our product line. I want you to have as much faith in it as I do, and I want you to truly see the beneficial outcomes that are to come of it versus other products, or really just versus any other therapeutic courses of action that you've taken in the past in treating osteoarthritis. I hope you have a good day, and thank you for your time. I know that you have a busy practice, so as much as I would love to sit here and talk to you about Orthovisc for longer, I know time is of essence on your end as well as mine, and I truly just hope that this information that I've given to you and this information you'll obtain within these brochures is enough of a convincing factor and much of a believing factor that this is a product line that's going to benefit your practice. I look forward to working with you, and I will be in touch with you in the week to come, if not sooner. So have a great day. Thank you.